The topic of this video is Lyme disease. Lyme disease is caused by four main species of bacteria. Borrelia burgdorferi and Borrelia mayoni cause Lyme disease in the United States, while Borrelia afzeli and Borrelia garini are the leading cause in Europe and Asia. The most common tick-borne illness in these regions, Lyme disease, is transmitted by the bite of an infected deer tick. Early sign of Lyme disease is a rash. It's called erythema migrans. From 3 to 30 days after an infected tick bite, people with Lyme disease get a characteristic bullseye rash. The rash gradually spreads over a period of days and can eventually reach up to 30 centimeters across. Symptoms is fever, chills, fatigue, body aches, and headache. Untreated new signs and symptoms of Lyme infection might appear in the following weeks to months. These include erythema migrans. The rash may appear on other areas of your body. Joint pain, bouts of severe joint pain and swelling are especially likely to affect your knees. Neurological problems. You might develop inflammation of the membranes surrounding your brain, so-called meningitis. Temporary paralysis of one side of your face that calls Bell's palsy. Complications of Lyme disease include chronic joint inflammation, particularly on the knees, neurological symptoms such as facial palsy and neuropathy, cognitive defects such as impaired memory and arrhythmia. Antibiotics are used to fight Lyme disease. At an early stage of Lyme disease, prescribed tetracycline-type drugs. Later, when joint cardiac and neurological changes appear, penicillin-type antibiotics are prescribed, which take 3 to 4 weeks. In parallel, analgesics are recommended to relieve pain symptoms. With a pronounced intoxication syndrome, infusion detoxification therapy is also indicated. The best way to prevent Lyme disease is to avoid areas where deer ticks live, especially wooded, bushy areas with long grass. You can decrease your risk of getting Lyme disease with some simple precautions. So, you should cover up. When in wooded or grassy areas, wear shoes, long pants tucked into your socks, a long-sleeved shirt, a hat and gloves. You should use insect repellents. Apply insect repellent with a 20% or higher concentration of DEET to your skin. You should also check your clothing, yourself, your children and your pets for ticks. Be especially vigilant after spending time in wooded areas. Deer ticks are often no bigger than the head of a pin, so you might not discover them unless you search carefully. If you had Lyme disease before, don't assume you're immune. You can get Lyme disease more than once. And you should remove a tick as soon as possible with tweezers. You should gently grasp the tick near its head or mouth and pull carefully. Once you have removed the entire tick, apply antiseptic to the bite area.